Welcome back. When celebrity chef Paula Deen, famous for her high-calorie comfort foods, announced her diagnosis of type 2 diabetes recently, it started raising awareness about a medical problem that affects 25.8 million Americans. Today, we'll look at some of the symptoms of type 2 diabetes, plus what you can do to treat the condition once you've been diagnosed. Dr. Anthony Enrico Jr. is a podiatrist at the Institute of Foot and Ankle Medicine in Patterson, here to offer some help. Welcome to the show.
Thank you. Thanks for having me.
Yeah, and thanks for being with us. Well, do you think that Paula Deen's story can actually be beneficial to people who don't know a lot about type 2 diabetes?
Well, I mean, she has a very successful show. She reaches thousands of people every day. I think if she addressed the diabetes, especially in her cooking, the way she cooks, I think it will be very helpful to a lot of people.
Yeah, and a lot of people don't know the symptoms either, what to look out for. And you actually sent us a list before you got here, and we're going to put it up on the screen. What are the top 3 most common symptoms that a lot of people need to look out for?
The top 3 would be, number 1 would be excessive thirst, having the desire to drink more than normal. Most patients know how much they would drink in a day, so excessive thirst would be number 1. The second would be excessive hunger. That would be number 2. And number 3 would be excessive urination. That's very common.
And then something else that you talk about is pain, numbness, tingling. What is that exactly called, and what should people know about that?
People that have diabetes also get what's called diabetic peripheral neuropathy. And what that is nerve damage that occurs in the hands, feet, legs, fingers. And patients experience different sensations, like numbness, burning, tingling, and they could even feel eventually loss of sensation.
And what can happen if you ignore these symptoms?
Well, if you ignore neuropathy, again, it could lead to loss of sensation, which could lead to foot ulcers, infection, and the worst complication would be amputation.
Amputation, yeah. You also sent us sort of a list of things that you can do to prevent and manage this disease, and we also have that list as well that we want folks to take a look at. And we're going to read through what they are: healthy diet, being active, exercising 30 minutes a day, taking vitamins and supplements, check your blood glucose daily, and maintain good foot care as well. What do you mean by good foot care exactly? Well,
diabetics have, as I said, have a lot of foot complications because that's where neuropathy occurs most commonly. And they should, most patients should inspect their feet every day. Make sure there's no cuts, no bruises, no redness, things like that. If they have anything they're concerned about, they should go see their medical doctor or podiatrist to be evaluated, because those things could lead to infection and other complications.
Yeah, and you're talking about a healthy lifestyle as well. Taking supplements, something that people can do?
Yeah, supplements are a big thing, especially for neuropathy. I mean, there's some prescription medications out there now for neuropathy. They have a lot of side effects. So all natural products, minerals, vitamins, things like that would be very beneficial to help that condition.
What kind of side effects can you actually avoid also?
Well, it's the prescription medications for neuropathy, the main side effect is suicidal thoughts.
Oh, wow.
Suicidal tendencies, blurred vision, dry mouth. I mean, most patients that I had prescribed it for in the past don't want to take it because it lowers their blood pressure, dizziness, lightheadedness, so they really don't want to take it. And that's what, you know, I've been doing some research on my patients as well, and I came up with my own product that's used to help neuropathy as an all-natural product.
And all-natural is the key here, because we're not talking about any, you know, prescription type of...
No, it's not prescription. It doesn't interfere with the medications they're taking. Now, most diabetics takes 5, 6, 7 medications a day, and the natural products.
What kind of ingredients are we talking about when
We're talking about B-complex, alpha-lipoic acid, and inositol. Those are the main ingredients that have a positive effect on nerve health.
How long does it take to kick in so people can get the benefits?
I would say 4 to 6 weeks minimum, you would start seeing the effects. But most people don't mind taking it because it's all natural. It doesn't interfere with their own medications.
And people don't realize just how serious this can be in terms of the problems that you can get with your feet. And I have to say that I've known a couple of older people who've had their feet amputated or parts of their body because of this. So this is very, very serious, not something to be taken lightly at all.
Oh no, like I said, the main complication is loss of sensation. I've had patients come in my office, they've had a little pebble or they even had a needle in their foot from the insulin syringe. They didn't even know it was in there until they took an x-ray. That could lead to infection. Like you said, it could lead to amputation, which is a devastating complication for diabetics.
Do you find that you're seeing more patients with the diabetic complications more and more these days? You've been in the business for 24 years.
Well, it also depends on the population. I mean, I happen to be in an area where it's a little bit more depressed, so people don't take care of themselves as well as they would in a different population.
Right.
And I do see a lot of patients, a high volume of my patients do have this complication.
So it's growing, and
Yes,
you've seen it.
Absolutely.
All right. Well, I really appreciate you being with us
Thank you.
today
Thank
to
you for
spread
having
the
me.
awareness a lot more.
Thank you for having me.
Okay. All right. Well, if you have any questions about anything that you've seen on today's show, email them to us at 12toyourhealth@news12.com. Thanks for watching 12 to Your Health. I'm Carissa Lawson, in for Dr. DeSilva. May you always be blessed with good health.